Hand hygiene and aseptic technique serves as the foundational title for this educational module. This lesson focuses on the critical intersection of chemical agents and clinical practices used to prevent healthcare-associated infections. We will explore the specific science behind how we clean our hands and maintain a sterile environment. Understanding these concepts is vital for patient safety and professional clinical practice. We will move through the chemistry of various agents, their specific indications, and the metrics used to measure their effectiveness in a medical setting. This introductory slide sets the stage for a deep dive into the protocols that keep both patients and providers safe from pathogens. 03 Hand Hygiene Agents and Chemistry is the specific lesson title for this section of the course. This chapter transitions us from general concepts into the specific chemical properties of the substances we use daily in the clinic. We will be analyzing how different formulations interact with microorganisms at a molecular level. By understanding the chemistry, healthcare providers can make informed decisions about which product to use in various clinical scenarios. This section covers everything from basic surfactants to complex antiseptic compounds like chlorhexidine and iodophores. It is essential to recognize that not all cleaning agents are created equal, and their chemistry dictates their clinical utility. Lesson 3, Hand Hygiene Agents and Chemistry. 3.1 focuses on soaps and surfactants and their mechanism of action. The mechanism is defined as physical removal through mechanical action rather than chemical killing of pathogens. The structure of these agents involves a hydrophobic tail that binds to dirt and oil, while a hydrophilic head binds to water to lift contaminants away. In terms of efficacy, these agents typically provide a 0.6 to 1.1 log reduction in bacterial counts. The indication for soap and water includes visibly soiled hands, cases of C. difficile to physically remove spores, and the presence of proteinaceous material. A key limitation is that they offer minimal antimicrobial activity and strictly require running water and thorough drying to be effective. Lesson 3, Hand Hygiene Agents and Chemistry. 3.2 covers alcohol-based hand rubs, or ABHR. The mechanism of action for alcohol involves protein denaturation and the disruption of the microbial cytoplasmic membrane. Its spectrum of activity is excellent against gram-positive and gram-negative bacteria, mycobacteria, fungi, and enveloped viruses like HIV and the flu. Regarding speed, the bactericidal activity is rapid, beginning within 10 to 15 seconds of application. The efficacy is high, providing a greater than 3.0 log reduction, which equates to 99.9% of germs. Notable advantages include being highly accessible at the point of care, having better skin tolerance due to added emollients, and being faster than traditional washing. However, limitations exist as ABHR is weak against non-enveloped viruses like norovirus and bacterial spores such as C. diff. Lesson 3, Hand Hygiene Agents and Chemistry. 3.3 examines chlorhexidine gluconate, also known as CHG. Its mechanism involves the disruption of the cytoplasmic membrane and the subsequent precipitation of cell contents. A major feature is substantivity, meaning its residual activity persists on the skin for approximately 6 hours after application. The spectrum is broad, covering many bacteria with excellent efficacy against gram-positives. Common use cases include surgical hand scrubs, central line skin preparation, and preoperative patient bathing to reduce surgical site infections. There are important contraindications to note. CHG can be ototoxic to the ears and neurotoxic if it reaches the brain. Therefore, you must avoid contact with the meninges and the eyes during application. Lesson 3, Hand Hygiene Agents and Chemistry. 3.4 discusses iodophores, such as povidone iodine. The mechanism of action is the oxidation of proteins, nucleotides, and fatty acids within the pathogen. Its spectrum is quite broad, covering bacteria, mycobacteria, viruses, fungi, and even spores if there is prolonged contact. The onset of action is slower than alcohol because it requires drying on the skin to release the free iodine necessary for killing. Primary use cases include mucous membrane preparation, such as during Foley catheter insertion, and for patients who are allergic to CHG. A critical factor is inactivation, as the antimicrobial activity of iodophores is significantly reduced by the presence of organic matter, like blood or sputum. Lesson 3, Hand Hygiene Agents and Chemistry. 3.5 looks at triclosan and antibacterial soaps. The mechanism for triclosan is the inhibition of the enzyme enoyl acyl carrier protein reductase, or FAB-I. Regarding its status, it has been largely replaced by CHG, or plain soap, in healthcare settings due to regulatory bans by the FDA. There is a significant concern regarding resistance, as sublethal exposure may select for resistant bacterial strains over time. In terms of efficacy, studies have shown that triclosan provides little benefit over plain soap for routine community handwashing. The overall lesson here is that newer chemical agents are not always superior to traditional methods, and careful stewardship of these chemicals is required in clinical environments. Lesson 3, Hand Hygiene Agents and Chemistry, 3.6 addresses interactions and incompatibilities between products. Regarding soap versus CHG, any soap residue must be rinsed off completely before applying CHG-based products to prevent neutralization. When considering lotions versus gloves, be aware that mineral oil or petroleum-based lotions break down the integrity of latex barriers, increasing the risk of exposure. For alcohol versus protein, alcohol can actually fix proteins like blood to the skin, so you must wash visible blood with soap first. In the case of iodine versus CHG, these are generally not mixed due to the potential for skin irritation and chemical antagonism between the two. The final guideline is to use only facility-approved product lines that are guaranteed to be compatible with one another. Lesson 3, Hand Hygiene Agents and Chemistry, 3.7 provides a guide for selecting the right agent based on the scenario. For routine patient care, the preferred agent is AVHR because of its speed, skin tolerance, and accessibility. For visibly soiled hands, use soap and water for the mechanical removal of the organic load. In cases of C. difficile or norovirus, soap and water is required for the mechanical removal of spores and capsids. For a surgical hand scrub, CHG combined with alcohol or iodine is used to ensure persistent activity under gloves. For central line prep, the combination of CHG and alcohol provides an immediate kill from the alcohol and persistence from the CHG. Finally, for mucous membranes, aqueous iodine is preferred as it is less irritating than high alcohol solutions. Lesson 3, Hand Hygiene Agents and Chemistry, 3.8 explains efficacy metrics and log reductions. A 1 log reduction represents a 90% reduction, where 100 bacteria are reduced to 10. A 3 log reduction is a 99.9% reduction, which is the standard for hand rubs. A 5 log reduction means a 99.999% reduction, the standard for surface disinfectants. Understanding clinical relevance is key. On heavily colonized hands with 1 million colony-forming units, a 3 log reduction still leaves 1,000 bacteria behind. The conclusion is that while hand hygiene significantly reduces the microbial load, it does not achieve sterilization. Therefore, rigorous aseptic technique is also needed to ensure patient safety. Thank you for completing this lesson on hand hygiene and aseptic technique. We have covered the essential chemistry of soaps, alcohols, and antiseptics, as well as the critical importance of selecting the right agent for the right clinical task. Remember that your adherence to these protocols is the first line of defense against healthcare-associated infections. Please take a moment to review the log reduction metrics and the compatibility guidelines, as these are frequently applied in daily practice. Your commitment to proper hand hygiene and aseptic technique directly impacts patient outcomes and the safety of the healthcare environment. We appreciate your dedication to maintaining the highest standards of clinical excellence and infection control.